like to go ahead and take up the consent agenda at this time. Items 1 through 13 on our agenda.
Move to approve consent.
We have a motion and a second. Public comment on consent agenda items, please.
Aaron Skrobak, District 4. Gary Hemmingson is my supervisor. Even though it would appear that the deal is already done, it is important that the supervisors know what a mistake it will be to bring California Forensic Medical Group into Del Norte to provide medical care for the jail and juvenile hall. The other name they are known as is Wellpath. Before the deal was reached in the attempt to push it through in the consent agenda, there was a working system already in place by Turtle Medicine, who had been providing the services needed. The new company, Wellpath, in fact, will not be reducing costs, but in fact will cost much more than previously. The decision made by the Sheriff's Office staff, Juvenile Hall staff, Department of Health and Human Services, Behavioral Health staff, and Program Management staff. But you know who was left out of making this decision? The very people you rely on to do the work, the nurses and medical professionals. The plan is now to bring in additional nurses and medical staff to work there. And where are these people going to be coming from? The hospital and other healthcare facilities. During the height of the pandemic in Del Norte, with cases on the rise and hospitalizations to the point of being beyond its capacity and needing state help to recruit with the surge. There's not enough of us nurses here in Del Norte to fill the job openings as it is. To change the current working system in place will have dire repercussions for other facilities in the county at a time we can ill afford to do so. So I'm asking the Board of Supervisors to reject this proposal to contract Wellpath and to continue using the services provided by Turtle Medicine. Thank you and have a wonderful day.
This is Patricia Black. It concerned me that this hasn't been fully discussed by you as the Board of Supervisors. I know the current system has its drawbacks, but I'm wondering if this is the solution, and I would love to have it come out in a full-fledged supervisory discussion. Thank you.
Okay, we'll go ahead and bring it back to the board. Is there anything further the board would like to address on any of the comments or direct questions to staff on item number 4? Sorry, 3.
If I could just ask if CAO Lopez can explain the process in which this was determined. I know it's in the content, so I've read it and I've considered it, but if it might ease some minds, if you could explain that, if that's not putting you on the spot.
No, not at all. This followed the typical process that we use through county proposals. It's a public request for proposal for jail medical services. This was published or put out in April of 2021. We received 2 bids for the proposal, and there was only 1 bid that was responsive. Do you want anything else?
That satisfies me.
Okay, no, I appreciate that. Thank you, Neil. Any other questions at this time from the board? Kyle, if there's no further public comment, please pull the vote.
Supervisor Starkey?
Yes.
Supervisor Berkowitz?
Yes.
Supervisor Hemmingson?
Yes.
Supervisor Short?
Yes.
Chair Howard?
Yes.
And with that vote, the Del Norte County Board of Supervisors approved a $1.3 million contract with California Forensic Medical Group, also known as Wellpath, to provide medical services for the Del Norte County Jail and Juvenile Hall. Wellpath, a $1.5 billion company located in Nashville, Tennessee, was awarded the contract over Turtle Medicine, a local company that has been providing jail medical services here in Del Norte County for some 20 years. Wellpath has a disturbing record of being the defendant in well over 1,300 lawsuits. But all of that is water under the bridge. The question now is how to ensure that California Forensic Medical Group, Wellpath, provides quality medical services to those people incarcerated in our county jail and juvenile hall. Previously, Del Norte County Administrative Officer Neil Lopez told KFUG Community News that the responsibility for holding Wellpath accountable will be borne by the supervisors of the county jail, juvenile hall, and Department of Health and Human Services, and he added that the buck stops with him as the county administrative officer. Mr. Lopez said that if Wellpath does not fulfill the terms of the contract, they will not get another one. Lynn Szabo is a well-known physician's assistant who has provided medical services in the Del Norte County Jail and Juvenile Hall. She's also been affiliated with Turtle Medicine. We asked Lynn Szabo about County Administrative Officer Neo Lopez's plan for holding Wellpath accountable.
So that's an administrative answer to a medical question, in my opinion. None of those people have any idea. Like, I recently had a conflict in juvie, which we don't really need to get into, but I was being told how to practice medicine by one of the guards there, and they clearly were coming from a political viewpoint and not a medical viewpoint. So yeah, those people have, I'm kind of flummoxed to think that they would be able to evaluate any of this.
So in the end, really what's going to happen is like CFMG and Wellpath are going to evaluate their own performance and basically give a report, right? Unless something grossly inappropriate happens.
Right. I have no specific knowledge of them, but I imagine that it would be similar to like what happens maybe at the community clinic level, that there's a lot of peer review and there's a lot of protocols in place, and they really do stick to them. For example, at UHS, my medical practice is evaluated by my peers, which is not only providers here in Del Norte, but providers in Humboldt County, pretty much quarterly and very thoroughly. And it's, we don't take anything personally because there's no point in that. We definitely are committed to doing it better, making it better. I don't know, sometimes that means more money, and sometimes I don't know really what they do in Wellpath. I think what's going to happen is there's going to be a lot of initial good things. But stay critical for a longer period of time, because I think, it sounds great to have addicts on Suboxone or, people with newly diagnosed hepatitis C being treated, or people having access to specialists and gee whiz on the telephone, on the telemed thing. But remember, they're not going to be able, I think they're not going to be able to sustain that goodwill. And I think it's going to be obvious that things will start to fall by the wayside because they don't have the resources. They really don't, that they think they do.
The locally based resources.
Right. But the same, internal medicine people aren't going to disappear. We're still taking care of your community, and we could still reach out and be helpful.
Physician's assistant Lynn Szabo was a guest on the Tuesday edition of KFUG's Health Matters. For KFUG Community News, I'm Mike Thornton.